C'est mon père, ça me fait bien tiens. Tu me fais dire non tout, era one radio. C'est mon père, tu me fais bien tiens. Tu me fais dire non tout, era one radio. Oh, and you punchima, asam punchima.
Good evening, Era One radio listeners and viewers all over the world. We are coming your way this evening on Era One Radio Studio, broadcasting live on Facebook and YouTube, also Modern Ghana Radio and Garden Radio. The number to call in is 24028026333. And if you want to text, it's 510-931-0946. The show tonight, as usual on every Saturday, is Health is Wealth, so protect it. And as we say always, your health is very important. No matter how much money you make in this world, if you are not healthy, if you don't live to enjoy it, it's useless. So you have to make sure you're watching your health. And if you are healthy, then you have much money. You can save money. You don't spend too much money going to the hospital. All right, tonight we are looking at a topic that has been tried and tested. It has actually tried me tonight because we were supposed to start at 6 o'clock. And my doctor friend, also namesake Charles, was a bit of technical glitches. So he already gave me high blood pressure. So he's going to address that and address my issue too, because he already raised my blood pressure for the event, for the discussion tonight. We are looking at high blood pressure, but before I do, I want to welcome him, and if he has any greetings, any birthday shout out he wants to give to family or anyone here. Doc, you are welcome.
Thank you. And thanks to everyone who's listening. This discussion today we're going to be having is regarding the high blood pressure, which is hypertension. And we're going to be touching on different things regarding hypertension and questions that people will be having during this discussion. You can ask, and then we'll try to address it the best we can while we talk.
All right, awesome. Okay, before we do, let me bring in a quick jingle, and then we'll continue.
C'est mon père, ça me fait bien tiens. Tu me fais dire non tout, era one radio. C'est mon père, tu me fais bien tiens. Tu me fais dire non tout, era one radio. Oh, and you punchima, asam punchima.
Hello, beautiful people of Ghana. This is Boison Specialist Hospital. We are so excited to announce to our people Ghana that we are finally opened and we are accepting patients. At Boison Specialist Hospital, our extraordinary physicians and nurses are here to provide a high-quality medical service to our extraordinary patients. Our services include primary care services, maternal, neonatal, and pediatric services. We also have an in-house pharmacy. We have X-ray and laboratory services available to you. Come to us for all your healthcare needs, and you will be happy you did, because we believe the health is wealth. Thank you, and stay blessed.
We are back to the studios, and as I said earlier on, we are broadcasting live from Facebook and YouTube, also on Modern Ghana Radio. And tonight, I have the pleasure of having my old buddy. We go way back. So I'm going to introduce him in a jiffy. But tonight, I want to ask you, how are your goals going for the year? I know every first day of January, every year, we all sit down, put pen on paper and make resolutions, among which we say we are going to lose 10 pounds or we are going to gain 5 pounds. We're going to hit the gym and maybe exercise 3 times a week, or cut back on the, eba, or too much jollof, or too much oil food or all that stuff. We make resolutions, and I'm asking tonight, how is it going? Are you seeing any improvements, or you want to wait till 31st December before you can say you are making improvements? Well, tonight we are taking a very serious topic that really affects the health of many people. I mean, the stats, we might not be able to go into all the stats, but hypertension is something that is taking the lives of many people. So we're going to, with the able leadership and knowledge from the doctor here, he's going to tell us what it is and then how we can prevent. But before I do, I don't want you to be wondering who this guy is. He's been on Erawan radio before, but I'll introduce him again. So this guy he's my old Navy guy. We met at Great Lakes when we started Navy boot camp. He was there, and as usual, that was around 98, I believe. And the head he carries, you can see his head is bigger than mine. It is not for that. It's not for aesthetic display. It's full of brains. The guy got brain. I mean, he's been valedictorian all the time that we were there, and he's still a valedictorian. Wherever he goes, this guy is chopping us first. So we met at Great Lakes, and then we also all went to sea school in Portsmouth. That is Navy laboratory school. He was there. He was still chopping us first all the time. The only thing is that he never stopped fighting with me over my wife's jollof, my own wife. He comes to my house to eat, and he wants to fight me. He comes and he grabs the bowl and put it somewhere, preventing me from eating the food that my wife has cooked with our money. And he was fighting with me. Of course, he knew that Ghana jollof was always and will always be better than Nigerian jollof. All right, so he's a nephrologist. He plays with people's kidneys, and I will let him in a jiffy tell us a little bit about what more he does that I haven't said. Doc, anything more you want to add?
Yeah, I do work as a nephrologist, and as a kidney doctor, we take care of things related to the kidneys. And one of the things we also deal with is high blood pressure. High blood pressure is something that really affects the kidney. Of course, it affects other organs as well. But today we're going to be discussing more on just high blood pressure by itself. And of course, in addition to that, we'll talk about the organs it affects and what we should do to prevent that from happening. And if we do have high blood pressure, what to do to prevent it from getting worse to the point that it affects other organs in our system.
All right, thank you. Well, before I forget, greetings from Lydia. We still have some jollof in the fridge, so if you want to pass by, you are welcome. All right, so before we go, I normally like to do a little bit of warm-up. I know our time is gone, but let me ask this question. Of course, 2019, the name that's the year that gave COVID-19 its name. We experienced COVID-19, and then 20 was when we actually felt it. And with time, it looks as if it's going now, it's not going. So let me ask you this question as a warm-up before we continue. Do you think we are going to experience any more? I know the virus keep mutating and coming back in the SARS-CoV comes back in a stronger form. But do you foresee this COVID thing lingering around for longer time? Are we going to meet it again this year, or we are done?
It's possible that we're going to, but the severity might not be as bad as it was before because of what's been achieved so far with medicine on the immunization and things like that. But so far, we still do experience part of patients coming with COVID in the hospital. How long this is going to last and when it stops, no one really knows that. Just like no one knew how long flu was going to last. Flu is still here with us right now. Better controlled, but it's still there. So I think the thing about COVID is something I don't think it's going to really completely go away, but it's probably going to linger on, and we just deal with it as we always deal with flu.
Okay. All right. As a Spanish would say, gracias. All right. So now we are going into our discussion tonight. And as I said earlier on in my preamble, we are looking at hypertension, high blood pressure. And so a lot of research or look up of what the word hypertension, comes from two words. The prefix hyper, which means over or beyond. So if you are hyper, normally if they say somebody's a hyper child, which means they are wild and energetic, the ones that will come from school and grab stuff and run around and all kinds of stuff. And tension means stretching or straining. So hypertension therefore means straining beyond. So now we are going into that's the layman's definition though. Now let's go into the medical where this young man over there will give us a proper medical definition. So Dr. Charles Ibie, namesake Charles, He has another name, but that is a little bit long, so I'll hide that one in the closet. We'll just go with Charles Ibie. All right, so Doc, when you guys say hypertension, what actually does that mean? I mean, in medical terms.
So in medical terms, what hypertension means is basically the cardiac output, how much the heart puts out, and the systemic vascular resistance, how much the resistance of the vessels are. You use those two together. The multiplication of both is what gives you blood pressure. So blood pressure itself, why we say someone have hypertension, we are supposed to have some kind of tension to our
Tension.
vessels, to some level. But the one that we consider hypertension is when that number is greater than 130 over 80. So the systolic blood pressure is greater than 130 and the diastolic greater than 80. That's what we call hypertension. So, but the definition is always the cardiac output and the peripheral vascular resistance. I mean, the systemic vascular resistance.
Wow. So there's some resistance in our vessels. And all right. So something is resisting the flow, the normal flow of the blood. So there's tension going on. All right. So one may ask, what causes that? Why do we have tension in our vessels?
Okay, so having tension in the vessels, there's a lot of things that can cause it. The risk factors we're talking. In this case, what we're discussing is risk factors, right?
Okay.
So the risk factors that will cause people to have high blood pressure, there's several various things that can cause it. Number one could be age,
Okay.
right? The older we get, we tend to have a higher blood pressure. So the other thing that can happen is weight gain, which is obesity. Obesity most times comes with being old, right? The older you get, you tend to gain more weight, and when you gain more weight, you have a higher risk of having high blood pressure. Another thing that causes that is a family history. That one we cannot run away from that.
The
If you
genetics.
have a family history where your family members or people in the family has high blood pressure, there's always a higher risk of you having high blood pressure. One thing that does always stand out in medicine over and over and over again is the fact that if you're a young black male, your chances of having not just high blood pressure, but high blood pressure that is so high that can cause damage to your vessels, the chances of that happening is way higher as an African American or a black person than it is with someone who's from other race. So one of the things we also say is like salt intake, right? This is going to diet now. This is not just
Okay.
genetic, but diet. So dieting, limiting your salt intake can help control your blood pressure. When we say limit your salt intake, what are we really talking about here?
You tell us.
What we are talking about is when the amount of salt you take in. When we say salt, we're talking about sodium chloride. It has to be less than 3 grams a day. Unfortunately, in this country that we live in, most people tend to take in a lot of salt. You go to Burger King, you go to restaurants, most places that we go, they put a lot of salt in their food to help preserve their food. That, on the other hand, would, of course, you enjoy the food, but then it can cause you to have high blood pressure, right? One thing we talk about a lot that everyone wants to do, like you started with the story about New Year resolution and all that, is physical activity. So inactivity helps to make the blood pressure go up, and increasing your physical activity helps to control the blood pressure. So most people always have a reason why they cannot do any kind of activity. They say, hey, you know what? I'm too busy. Work is stressful. One thing or the other, they don't want to work out. So they don't want to do any kind of activity at all. They don't want to diet. They don't want to work out. So all those things is one of the reasons that blood pressure would tend to be higher. Another reason is alcohol intake. Excessive, not just alcohol intake, but excessive alcohol intake. If you're drinking so much, not working out, overweight, all those are leading to high blood pressure. All right. I'm just discussing the
The
risk
causes.
factors,
Okay.
right? Another thing that also causes it is basically, of course, insufficient sleep. They usually say less than 7 hours of sleep a day. If you sleep less than 7 hours, that can cause you to have high blood pressure. But again, let's look at the whole thing though. When we are looking at all these risk factors, we are not just focusing on one risk factors.
Okay.
You
Multiple.
have to look at everything. Because if you have one or two here, let's say you're not sleeping that much, you sleep about 7 hours or less, but you have a very high activity, you don't eat too much salt, you decrease your alcohol intake, you're not obese, of course, your chance of having high blood pressure will probably lower.
Well.
But if you have all this and on top of that, you don't even sleep well, your chance of having high blood pressure will be higher. The one that for sure most people can't even control because of their what happened to them or the situation is socioeconomic status.
Okay.
So if you have a poor socioeconomic status, there's no way you're going to be talking about going to the gym to pay for the gym, right? So if you cannot pay for the gym and you cannot work out because you have to work extra just to make ends meet, all those two can lead to high blood pressure. Even the stress coming from not being able to pay your bills or looking out for the next bill to pay, that can cause high blood pressure too. So those are the things that we need to look into when we're thinking about high blood pressure.
That is a mouthful. Thank you very much, Doc. You've broken it down in very, very simple terms. You mentioned something about age, that as we age and as we old, our, of course, age comes also with lessened or decreased metabolism. So when we look at age, at what age can we say, or what is the lowest age that somebody can begin to experience hypertension? I mean, if you look at somebody who is, let's say if somebody is 20 and experiencing hypertension, we'll say maybe that is weird because you are too young. But technically, at what age do people begin to experience high blood pressure?
There is no age limit, really.
No age?
No. People can start having blood pressure when they're like in their teens,
Teens.
when they're like in their 20s, 30s, 40s. It doesn't really matter. I've had people who's 21 and their blood pressure led to their kidney failing.
Wow.
And I've had people who are 16 years old, their blood pressure led to their kidney failing. So when we talk about age, as you age, you tend to end up gaining more weight.
Okay.
Gaining more weight can lead to higher blood pressure. But that doesn't necessarily mean that when you age, you are bound to have high blood pressure.
Okay.
If you can control your health by doing physical activity and eating well, you can still stay away from having high blood pressure even at an older age. I've had patients who are like in their 80s and 90s and they have no high blood pressure. Meanwhile,
Are they obese?
no, they're
Okay.
not. So I've had people who are like 16, 17, sorry, I mean 18, 20, 21, who are on dialysis because their blood pressure is uncontrolled. Now, what are we talking about here? What we're talking about here is genetics.
Oh, okay.
So when you have genetics playing a part in the blood pressure, there is really so much you can do about that. You have to increase your physical activity. You have to take the medicines as prescribed. Those things really have no age to it. But if
You are
there is no
blessed with it.
genetics, then you can say, okay, well, the older you get, maybe you're in the 40s, 50s, and 60s, you can have a higher blood pressure. But to tell you the truth, blood pressure has no age limit.
Wow. So in essence, what we are saying is that hypertension is no respect of age. It doesn't matter what age you are, it can grip you. So yeah, so it looks as if hereditary or genetics play a major role. And for those of you who are wondering what genetics is, it's that part of your system where you are blessed. You are born with it. Your parents gave you those genes, chromosomes, whatever it is. So you don't really have too much leeway out. You are blessed with it. It's like a gun, I don't want to use that analogy, but it's like a gun that is loaded. It's loaded until the trigger is pressed or pulled. Nobody dies. It's there. It's loaded. But then once it's pulled, it goes off. So you are born with this, gun loaded in your inside. But then you can do something about it, because when you start life and you say, you know what, my parents blessed me, or not using the word blessed, bequeathed me or gave me these genes, I can do something about it. That's when environment comes in. You can decide, okay, I have the genes, I am predisposed, it's going to affect me, but then I'm going to work hard, or looking at what I have, I'm going to stop eating, like Doc said, too much salt. I'm going to exercise recommended 3 times a week, but you will do 5 times because you have a problem and you want to go against it. So your genes, your family can give it to you, but you can decide, hey, you gave it to me, but I'm going to fight it and change my situation. Anyway, that is just for me to put in there. I don't want to say more than what the doctor has said. I mean, I'm just the host. All right. Now let's talk about gender. Do we have any specificity? Well, some people can say, oh, men are prone to hypertension more than women. Is that a myth, or is that a fact? Is it true?
That depends.
Depends. Okay.
Right? Because like I said, if a young black male, African American, have a higher chance of not just having high blood pressure, but more severe high blood pressure, and more high blood pressure that can lead to end organ damage. When I say end organ damage, that means heart attack, stroke, or kidney failure, right? They have a higher risk of having that. But when it comes to high blood pressure, gender-wise, it really doesn't matter. It can happen to a male, it can happen to a female. If a female has obesity, or they have high salt intake, or they have physical inactivity, they also just have a high risk of having high blood pressure than a male that has the same description would also have. So the fact that you're a male or a female does not exclude you from having high blood pressure just because you are a gender. It actually matters if you have the risk factors or not.
Okay, all right, I understand. I take your word for it. But statistically, I mean, has it been proven, or from what you see in your clinic, can you say that one gender overrides? I understand what you said about the factors, but I'm just statistically, if you are taking a men and women, on the average, do men supersede the women or vice versa? Or you still want to maintain your response?
I would maintain my response.
You sure?
Because why would I say that? I'm saying that.
Oh man.
I've had men who comes to my clinic and have a blood pressure that's completely uncontrolled. Okay. And we have to use about 5, 6, 10 medicine to control their blood pressure, and it's still not controlled. And I've had women about the same age who comes in and their blood pressure is not controlled, and we've had to use several medicine. But one of the things that usually plays a big factor in all of this, of course, we know genetics play a factor already, right? One of the other factor that play, one of the things that play another factor is the fact that most people have non-compliance or non-adherence to their medicine. They don't take the medicine. So when they don't take it, you don't know if it's because they're not taking their medicine or if the medicine is not working. You see what I'm saying? Okay. So at the end of the day, who gender-wise, does men or women have more blood pressure? There's not really been any study that I can tell you that said, okay, they put several male together and put several female together and say who has more blood pressure. I don't know of any study like that.
Okay.
You know, but just from what I've seen, I cannot say there is a more predisposition to men or women.
All right. Thank you. Let's take a quick break so you can get some water and then we'll continue. Thank you.
Right.
Chimafidi non kotu era one radio. Samupe jumpe bietia. Chimafidi non kotu era one radio. Oh, ayum pamchuma. Chintu asam pamchuma. Chintu egratum chuma. Era one, yebebo numpankua.
Right, you're still watching Era One Radio. We are broadcasting live on Facebook and YouTube, and also on Modern Ghana Radio. The show tonight is Health is Wealth, Protect It. and I have Dr. Charles. You see his long name on the link, so at least you can pronounce it yourself. I don't want to lead you into anything, but you can see Dr. N is right there in the house. Well, before the jingle, we're talking about the gender bias and whether statistically men do worse than women on hypertension. He actually, smart as he is, he stood in the middle. He didn't want to give himself up, but it happens, of course. All right, so let's look at treatment. Somebody can say, okay, I have the genes, it's in my system. My parents gave it to me. I can't do anything about it, so I'm just going to live my life anyhow. Why is treatment necessary?
Treatment is necessary because without treatments of high blood pressure, then the other risks that come with it just amplifies, right? The risk we're talking about, of course, with high blood pressure, someone can have heart attacks just from that extreme pressure. Like we described, the cardiac output and systemic vascular resistance. If you have so much of that, like people getting their blood pressure as high as the 200s, 180s systolic, that can lead to myocardial infarction. That can lead to pressure in the heart itself. That can lead to stroke. It can lead to ischemic stroke, where the brain just don't have enough blood flow to them because everywhere else is getting too much pressure. Wow. Or the brain can lead to a bleed in the brain because there's so much pressure, it just bursts and the person just bleed. I cannot begin to emphasize how important it is to treat the blood pressure, because I've seen so many young male, mostly in this case, who has been admitted to the hospital because they had a massive stroke. A young person, 20-something years old, 30-something years old, 40-something years old, who ends up in the hospital just because of blood pressure that could have been controlled, and end up in the ICU, intubated. Even when they get extubated, they cannot move half of their body for the rest of their life. That is something that definitely needs to be addressed, because for someone to get a condition, like we all know, genetics can cause you to have high blood pressure. The fact that genetics cause you to have high blood pressure doesn't mean that you can't control it, But if you decide not to take the medicine, because one of the main reasons people don't take medicine for blood pressure is because they said that it decreases their libido. If they take the blood pressure medicine, they can have sex like they used to. Because of that, they don't take the blood pressure medicine. But they don't take the blood pressure medicine, and then they end up not using half of their body. So that just don't make any sense. So again, to answer your question, why do we need to control this blood pressure? The reason we need to control blood pressure is because it can cause you to have stroke, it can cause you to have a heart attack, it can cause your kidney to fail. So those are the main big reasons. Of course, it can cause death. Let's not talk about that just yet. But the things that can happen while you're still living, those are the ones I'm talking about right now.
Okay. All right. Let me go to a fifth grader's question and ask this question. You mentioned the control. So when it comes to treatment, whatever medication they prescribe, does it actually control the disease, or it makes it go away completely? And if it does the disease come back because you are not taking care of yourself well?
So control is a lot of different factors, and those factors, when you started the conversation, you talked about, okay, are we gonna do a New Year resolution and try to do this thing for a few times and stop and wait till December 31st and then readdress everything all over again? It's all about discipline.
Okay.
Everything is about discipline. So for everything you do, you have to put discipline into it. When I talk about discipline, so medicine, there's medicine to control blood pressure, right? There's physical activity to control blood pressure. There's decrease in salt, diet, basically. There's diets that you can use to control blood pressure. So those things, if you know these things and adhere to them, not just for 1 month, for the rest of your life. So what happens sometimes, a patient comes to me and say, my blood pressure is good, I'm taking all my medicine, but my blood pressure is very good. I don't know why I should keep taking this
Continue.
medicine. So should I just stop the medicine then? The answer to that is no. Because if you stop the medicine that's controlling your blood pressure is going to go right back up.
Back again.
So the fact that your blood pressure is controlled just means that you're on the best treatment for you. It doesn't mean that you should come off the treatment hoping that everything will just be great all of a sudden.
Go back to
So
normal.
you have to continue this treatment for the rest of your life.
Wow. Okay, let's look at some of the chronic diseases like diabetes. Of course, you mentioned the sugar and all that stuff. How does that relate to hypertension? Is it correlated? If being diabetic, could that also give you high blood pressure?
No.
It doesn't. Okay.
Being diabetic will not cause you to have high blood pressure, and having high blood pressure will not cause you to have diabetes. However, having both can increase your risk of having other end organ damages.
Oh, wow. Okay, thank you for that. And then I think earlier on you had mentioned something about patients who were on medication and they stopped because of low libido and all that stuff. So somebody wants me to ask, if you are taking medication, does that or could that lead to impotency? I know men are scared about that, Yeah, you briefly touched on that, but then taking medication, is that going to make you impotent? Because when it comes to men and, sex, they are so particular, they will leave their medication and rather enjoy that. And before I digress, there was a story about an elderly man who went to see his doctor, and he wrote medication, the prescription he gave him. I think there are about three or four, and it was all expensive, So the doctor told him to, he actually went and came back and said, "Doctor, medications are too expensive. Can I leave some or whatever it is?" And this guy said the doctor should take some out, but leave the one that will enable him have sex, which to me was kind of serious. The doctor said, "Why do you want me take everything out and leave the one that can enable?" I said, "Well, I like that one." He said, "Well, you are going to die from that too." So back to my question: does taking the medication leads to impotence, and should people be scared about that, especially the men?
Well, that's a loaded question because, let's talk about the blood pressure again. What is high blood pressure? We're talking about cardiac output and systemic vascular resistance, right?
Okay.
How do we get erection? We get erection from the vascular resistance, right? So you take these medicines, some of this medicine decreases the vascular resistance. So if they decrease the vascular resistance, they decrease your libido, right? So the thing is, there are medicine that can cause you to have decreased libido. That's for blood pressure as well. So it's a catch-22. It is, because I have had patients who come to me and say, "You know what? Yeah, my blood pressure is controlled, but I'm not able to have sex with my wife or my girlfriends anymore. And because I'm not able to have sex with them, they've proposed to me that they want to go sleep with someone else."
Oh, wow.
So for me to keep them, I have to stop taking my medicine. So for this kind of patient, sometimes we try to see if we can use one of those medicines like Viagra or things.
Okay.
But the problem with that is you cannot use the medicine like Viagra for someone who's taking some kind of blood pressure medicine.
So it's like contraindication, huh?
Exactly. So it becomes very tough. So again, when you have genetic factors that can cause you to have so high blood pressure that you need so many blood pressure medicine to control, I totally see their point. They're in a very tough spot, because take the medicine, your blood pressure is controlled, your libido is lower. Don't take the medicine, your blood pressure is not controlled, you have a higher risk of having.
So you got to choose one. You have to choose one.
You have to choose one of the devil, right? None of them is good, right?
Oh, Lordy,
Because it's
Lordy.
almost like, okay, well, well, I really want to have sex and I really want to have this woman still in my life, right? But I will have this woman in my life. I don't know how long, because it might be tomorrow. It might be next that I'm going to have this stroke. I don't know. So that's a problem. Again, like I said before, I've seen so many people, mostly African American, black male, high libido guys who end up on the vent because they had a massive stroke. Some of them make it out and just be paralyzed halfway, or some of them die in the process. But you don't know which one you're gonna be.
Wow.
So there's no good end to it. Blood pressure, when it comes to genetics part, then the blood pressure is so high. Unfortunately, the only thing to do is to basically try to control the thing. You try exercise, you try diet, and you try medicine. And hopefully, some people can try to do exercise. And as they exercise more,
okay,
and they get fit better, they can come off some of the medicine. Not all of them now, but some of them. But again, that takes a lot of dedication. You see what I'm saying?
Yes, sir. Wow. All right. We'll be coming to the foods, what foods to eat and what not to eat to make sure you are maintaining the normal or the appropriate blood pressure. So let me bring in a quick add-on, a tea that helps with diabetes. And when we come back, Doc will take us to the food that we are supposed to be eating and what we are supposed to stay away from.
This is not your typical green tea. The Major Herbal Tea by Glucose Care International is a nutritious drink and a natural blood glucose reducer. Gymnema plant, the active ingredient in the Flamingo Herbal Tea, suppresses the absorption of carbohydrates ingested from your diet. The green tea content in the Flamingo Herbal Tea promotes rejuvenation of dead cells, detoxification of your system, stimulates the pancreas to release insulin, and improves metabolism. Drinking one sachet of Flamingo Herbal Tea after meals prevents the rise in blood sugar levels, suppresses appetite, and improves bowel movements. Drinking Flamingo Herbal Tea regularly after meals can also prevent type 2 diabetes. We encourage you to drink Flamingo Herbal Tea 3 times in a day, coupled with mild exercises to maximize its benefits. Flamingo Herbal Tea has been approved by the FDA. Toxicity test conducted by SGS, so it is safe and non-toxic. A product of Singapore. With Flamingo Herbal Tea, your peace of mind is guaranteed. Call our shop now on 0245 810 623 and set your path to good health.
All right, tonight we're talking about hypertension, and this year has to be a new you, a new year and a new you. It was Albert Einstein who said it clearly that if you keep doing the same thing over and over again and you expect different or new results, then they have a place for you called asylum. You are lunatic, you are insane. So if you want to change what is going on with you, then you have to try different approaches. If you've been exercising once, let's say a month, and you haven't seen the weight loss or what you want to do, then you want to up your game and change. So we are continuing the year with, the things that should make you experience normal, blood pressure, whatever numbers you want to talk about. And I'm glad to have Dr. Ibie here to take us through the hypertension. Now let's direct our attention to food, what we need to eat and what we don't to make sure that we are maintaining this body, this temple of God, in the stable, healthy manner so it can take us. Why would somebody die at 40 and somebody also go all the way to 102? That is not cute at all. So we have to do whatever we can to, maintain our health and live longer periods on it, to see your children's children attend all the weddings and graduations and everything. It depends on how you treat your body. If you treat your body well, it's going to treat you well. So Doc, over to you. What are the foods we are supposed to stay away from? You mentioned a few of those, salty food and all, but then oil and stuff. I know, I've gone to parties where my people say, oh, I want that big meat on that side. I want that oily one. Take us through that. I mean, yeah, we have 8 minutes.
Yeah. So for high blood pressure, there's a diet that they call like the DASH diet. DASH diet meaning dietary approaches to stop hypertension.
Oh
That's what
wow. Mm,
DASH diet.
that's new.
Okay. So that DASH diet, what is DASH diet? DASH diet is food that's high in vegetable, fruits, and low fat dairy products. Of course, grains, whole grains, and things like that. Poultry, fish. Those are the things we usually try to focus on more. And
Okay.
the ones that we tell you to avoid is red meat.
Hmm.
Red meat. When I talk about red meat, I'm talking about steak. I'm talking about hamburger. I'm talking about like deer meat and things
Okay.
like that. This does not involve pork, of course. People talk about bacon. Bacon, yeah, bacon. The thing about bacon is not the bacon itself, is the high salt
High
in the
salt.
bacon that you should be careful about. So if you're eating bacon and you have a lot of loaded salty bacon, then again, now we come back to the salt diet,
Okay.
right? Low salt. So the other things we talk about with diet part is you need to limit the sugar sweetened beverages that you drink.
Mm.
So you cut down on the sugar food, you cut down on the salt, you cut down on the red meat, and you increase your fruits, your vegetables, poultry, fish. Those are the ways to help also control high blood pressure. Again, like I said before about the risk factors earlier, we talked about the low socioeconomic status, right?
Okay.
So now think about what I just talked to you about. So I'm telling you about fruits, vegetables, poultry, fish. None of this is cheap.
That's the problem. Mhm.
So you have someone who has three jobs, can barely make it, and you're telling them don't buy hamburger, right? But go eat poultry, fish. Go eat poultry, go eat fish, go eat fruit and vegetable. They can't even afford that. So again, that's another thing that's why that socioeconomic status is a big factor when it comes to high blood pressure maintenance. So those are the things that you're supposed to think about when you think about diet.
Wow, yeah, that is awesome. I mean, you've really broken it down. I mean, well broken down. That's true because sometimes there are some foodstuffs that are not really cheap. We rather go for, let's say, like, I can get $1, go to a fast food joint and maybe get something cheap. As cheap as it may be, it may not be as healthy as you want it. So that is also a different issue. Well, but before we end, let me ask you, Doc, is COVID-19, is it a prerequisite for high blood pressure?
COVID-19 and high
Yeah.
blood pressure.
Is there any correlation?
COVID, I wouldn't say that because COVID-19 is pretty new right now, and we're still like trying to like look more into it and see more things regarding COVID-19. There are things that COVID-19 will cause during the acute phase that can cause to a kidney problem, high blood pressure, and things like that. But usually after it resolves, it usually doesn't stay. People usually don't stay hypertensive afterwards.
Mm.
So right at this moment, I can say yes, it is.
All right, thank you very much. Well, you mentioned something about socioeconomic factors. You know, your status, your the income you make, what food you want to eat. Because, like I said, people would prefer eating the cheap food in terms of quantity than eating it in quality for their health. I mean, if I can get something to survive on, that is a problem. And living in the areas where you don't have the ability to exercise, gyms are not available, even working trails to just live in, excuse me to say the word ghetto, your income will place you in different status. That is why I'm not bragging, but for my research that I did for my dissertation, this is the book that I came out with, Relationship Between Family Income and Obesity. This book is very good. Go to Amazon and get a copy. It addresses the socio-economic factor that Dr. Ibie said, everything about obesity. You want to have a copy and buy a copy for somebody. Well, if you buy and I get a lot of money, I'll bless Era One Radio. So it goes in the mix and comes back to bless as well. On behalf of Era One Radio and my studio manager, Dr. Ostus, I want to say, Dr. Ibie, thank you very much for spending an hour of your time with us. I know we had some glitches in the beginning, but it's all worth it. So before we end, I will go a little commercial, and then when you come back, you give us your closing remarks, and then I can send you back to your wife. All right.
They are four women. They are beautiful with brains. They are eloquent, decent, wise, and experienced. You have heard many, the funny. Now, it's time to hear the experience and the brainy. Meet Selena, Dorcas, Gifty, and Annette as they present the real in common getting. In common biaye sesi chain, a dead, as in takre no assume the dead, the real in common getting. Showing live this and every Sunday, 7 p.m. on Era One Radio on Facebook and on YouTube, Era One Radio and our Taibo channel. Kaise, so we see the real in common getting what brabon tete, we nyan konkonsa, we the real in common getting.
Era One Radio, we are broadcasting live from Facebook, YouTube, and Modern Ghana Radio. One thing about Era One is that we are a teaching platform. We educate, we entertain, and we inform. And there is a program that our studio manager organizes every Saturday from 6 to 9. What he does is he invites folks who have talents and gifts, especially in the singing area. If you think you are not being adored enough, reach out to the studio 240-280-2633. Talk to Dr. Ostus, and he will interview whatever God kind of gifts he's giving you. You can adore your singing, gift and bless the word. So listen to this clip, and then I'll come to Dr. All right, so you have any gifts, any singing gift, any whatever you want to showcase, reach out to the studio, and Dr. Ostus will interview you and make sure the gift that you have are being adored. And later, when you feel like, hey, I've been so blessed, you want to bless the studio to help out with those who are less fortunate, that's fine. All right, it's been a pleasure having Dr. Charles, my namesake, but of course I'm the original, so we don't dispute that. I mean, I'm not saying he's a fake one, but I'm the original, But when it comes to medicine, he is the boss. It's been a pleasure having him in the studio tonight. Thank you very much on behalf of all of us here. Thank you. All right, Doc, any closing remarks before we wrap up? Of course, I have some, like I said, I have some jollof that maybe I'm going to FedEx you. So thank you for gracing our occasion. Yeah. Any closing remarks?
I'll be waiting for the jollof, by the way. But anyway,
Don't worry.
My closing remark is high blood pressure is something that we fight a lot about when it comes to medicine. We have a lot of patients who have high blood pressure. Either they don't want to take their medicine, they don't want the physical activity, or they don't want to do the diet. So blood pressure is something that can be controlled. It can be controlled.
Okay.
But for it to be controlled, you have to follow the things that are supposed to be done. Diet, exercise, and taking the medicine like it's supposed to be taken, like it's been prescribed by your healthcare provider. And if it's not working, you have to talk to the person who's prescribing it for you. And one of the things with blood pressure is you have to check your blood pressure at home yourself. Do it in the morning, do it in the evening. Try to manage it that way too, and see what direction it's going. Is the medicine you're getting, is it working or is it not working? Is the activity you're doing, is it good enough or is it not? But again, with activity, it has to start slow. You cannot go from 0 to 100. You have to slowly increase your activity to the way you can tolerate it, so you don't cause problems for yourself in the process. And diet, the same thing. You have to always start slow with everything. And at the end of the day, that you have to remember that this is a lifestyle. When we talk about lifestyle, this is your life. This is something you're going to do for the whole of your life. You don't have to go to where you need to be in 1 year.
Okay.
You can slowly and go that way. But as long as you're aiming that direction, you will get there. You just have to be consistent, and you have to stay persistent with everything you're doing. Because at the end of the day, if you're disciplined, you're going to get where you need to be.
Sure.
But blood pressure is definitely something that needs to be controlled, because the side effect of not controlling it can be too detrimental.
Mega. Well, the doctor has said is then be consistent and be persistent. Whatever you set your mind to do this year is achievable. If only you will do the things that have been prescribed, your doctor's prescription of your medication, exercise. Exercise doesn't cost you that much. Walking around the neighborhood, jogging here and there, they are all part of exercise. And I know men will make an excuse. So, oh, I do the other stuff in the bedroom, so that's exercise. Well, I don't think that is enough. You have to do proper exercise. So, Dr. Charles, thank you very much. I don't even want you to comment. They didn't go there. It's going to take us another lecture. So just keep it that way. Well, thank you very much for, spending your evening. I know you were supposed to go out with the family and you have to, shelve it to be with us. So thank you very much. My appreciation and gratitude to your family, and say hi to them for allowing you to be. I know you are coming back. I don't want to promise right now, but off air we'll talk. We have to come back with all the point and knowledge in your head. You have to share with us. So thank you very much, and I'll talk to you soon. All right. Have a good night.
Yeah,
bye.
Thank you too. Bye.
Bye.
Kosuanati era one radio. Empenyini say. Yensuma na motenten yesuma benyasafo era one radio yedin sem anumwaye ebrem.
Aden urefiana Seo to me manya eni about Aden wasua mani suwa fosunya day Aden meba Aden kra Eya useni da swasa Eni da suwa Eni da suwa